Thank you for clicking on this video and welcome to my YouTube channel. In the next 5 to 7 minutes, I'll be telling you everything you need to know about a medical disorder that has been linked or associated with unchecked or excessive selfie taking. The best part, after watching this video, the following will be at your fingertips. 1. You know what this disorder is. 2. You know if you or your loved ones are at risk or is suffering from this disorder. 3. You know the factors that predispose one to having this disorder. 4. Importantly, you know how to prevent and manage the disorder. 5. The last but not the least, you know when it is necessary to see a medical professional. Before I start the presentation proper, I will encourage you to share this video as it's definitely going to benefit you and your loved ones. Thank you. Well, let's appreciate a quick fact check on the word selfie. Do you know that the word selfie was named 2013 Word of the Year by the Oxford Dictionaries? The word was an Australian slang first used by a young drone to describe a self-portrait photograph. Presently, this art has spread around the globe like wildfire and occasionally with negative implications or tendencies. What is selfie? Just look around you if you're in a public place. Shopping mall, supermarket, beautiful scenery, you must see somebody doing it. I know you know what I'm talking about. Anywhere you see them doing it. So what is this selfie? Selfie simply is a photograph that you take of yourself, usually with a mobile phone, or is a photograph that one has taken of oneself, typically one taken with a smartphone or webcam and shared on social media. In this second definition, the ending, let's know the ending. It's not just taking the photograph, but sharing it on social media. The emphasis of this presentation is on this ending. So it's a picture that you take of yourself and you express yourself on social media and you share it on social media. Of course, it gives a feeling of telling the world about yourself. So it is a form of self-expression. However, recent study seems to suggest that the extreme, that is, if the urge to click selfies and share it with the world is unchecked and out of control, it may indicate an underlying mental health issue called selfitis or selfie addiction or selfie disorder. How do I mean? You cannot hold back from clicking on your selfie and sharing. Anywhere you are, you want to take a picture of yourself and share and express yourself. If this urge is unchecked and out of control, psychologists are saying it may indicate an underlying mental health issue called selfitis. So in this presentation, I'll be interchanging selfitis with selfie addiction and selfie disorder. So what is selfitis or what is selfie addiction? It simply means obsessive taking of selfies. Based on the last part of the definition, it will imply that obsessive taking of selfie and sharing it on social media. Is that clear? So it's not just clicking on selfie or taking selfie or photograph of yourself, but you share it uncontrollable on social media. According to psychologists, selfitis is a genuine mental condition that makes one to feel compelled to constantly take photos and post them on social media. Do you know anyone or are you someone that constantly take photos, or you know someone that constantly take photos of himself or herself and post them on social media? Let's go ahead and see. What are the factors contributing to selfie addiction? Let's think. What are these things that put us at risk of having this condition? First and foremost, importantly, one is environmental factors. Come to think of it, who wouldn't want to have a pictorial memory of a beautiful scenery? So, under this, selfie, of course, it helps to appreciate the environment better. Imagine you are in a very lovely, beautiful scenery or environment with beautiful flowers. The urge of taking pictures may be there so that you have that pictorial memory. Of course, it also forms good and happy memories of various experiences. You know, by doing that, you remind where you were in so place, you know. So, it's a factor that can make one take pictures unchecked. Another important factor that may predispose one to self-hate is social competition, needing to be the best, because it helps to elevate social status and importance. Imagine you are in a very fine place or you travel to an expensive place and you take a beautiful picture and you share it on social media. You know, your groups, your peers, others may say, wow, this guy is doing very well. And that, of course, will elevate your status. It also helps one to get more likes and comment on social media. Imagine snapping with a very tush car, very expensive car, or in an expensive hotel, or on a vacation in an expensive environment. People will definitely comment, you know, and like, and that will boost your social status. Another factor that will put one at risk of self-hate is attention seeking. Of course, it helps to make one popular on social and friend circle. You see, you're always posting, people must know you and comment. So, and they will talk about you. So, if you are someone that need attention, this will help you. And by doing this unchecked, it may predispose you to this mental health disorder called selfitis. Of course, it will help you to gain attention and notice and comment on your social media. And that is what attention seeking persons want. So, attention seeking is another factor that may predispose one to this condition called selfie addiction. The fourth factor is that it helps in elevating mood. By taking beautiful pictures and watching yourself, it makes you feel very happy and you'll be less stressed. You know, you feel light, you feel euphoric, you are happy with yourself, and it will also make you feel good about yourself. So this factor is possible to predispose you to the risk of having disorder. Mood elevation. Another factor is improvement of self-confidence. Of course, for some persons, selfie helps them to feel more confident and self-assured when taking it, you know. After taking it, you appreciate your look, you feel okay, so this I'm this beautiful, I'm this handsome, I'm this lovely, and that will help to boost confidence. But of course, if it is unchecked, it's a risk that could predispose you to this condition. Another important factor is the tendency to conform to peer group expectation. In recent times, everybody is doing it. Why won't you do it? So there's that tendency because of peer group or peer pressure that you want to do to feel belong. Of course, by doing that, you feel respected and accepted, you know, by the circle. So this can predispose one to taking selfie and posting on social media unchecked. Who are at risk of this medical disorder called selfie addiction or selfie disorder or selfitis? I know you know it. It's usually aged, middle-aged, young, middle-aged, predominantly female, of course, female. We are not excluding men not doing it, but it's more in the female circle. Mm, Everybody is involved. Everybody. Everybody. However, it is more among the females than their male counterpart. Let's not argue it. It's real and it exists. It happens to male and it happens to female. Is that okay? Oh, thank you. Thank you. Oh, thank you. Thank you. What are the symptoms of self-hate? Someone that is having this disorder, what do they do? What gives them away? What is those things they do? They'll say, okay, this is the problem. Alright? Alright. This disorder, self-hate, is classified into 3 levels. Yes, into 3 levels. Let's listen carefully. Level number 1 is called the borderline level. Here, the person click his or her photos at least 3 times a day, but not posting them on social media. You see, you take selfies at least 3, you look at them, you keep clicking at least 3 times in a day, but here, you do not post. That's the first level, the borderline level. The second level is called the acute level. It involves taking self pictures at least 3 times a day and posting them on social media. You can see the difference. In the first level, you take pictures at least 3 times in a day, you click on them, but you don't post. But in the acute level number 2, you take pictures at least 3 times in a day and you post them or you share them on social media. The third level is called the chronic level. You cannot imagine what that means without telling you. What do you think this will be? Well, in this level, here there is an uncontrollable urge to take selfies continuously and posting them on social media more than 6 times in a day. You take selfie continuously, unchecked, and you post all of them on social media more than 6 times in a day. Are you that kind of person? Do you know someone that is experiencing that? Or do you think you are at risk of this? Well, let's go forward and see. What are the mental effects of self-hate? Person obsessed with selfies may have one or more of the following emotional and mental issues and may need a medical help. Below are the mental effects. 1. Loneliness. 2. Unconscious cry for help. 3. Obsessed with self. 4. Highly attention seeking. 5. Difficulty relating with people. 6. Addiction tendencies. 4. Suffering from stress. And last but not the least, lacking in confidence. Based on studies, the dominant characteristics of the person are identified as any of the following. 1. Loneliness. 2. Attention seeking. 3. Self-centered or narcissistic. Unless treated, the underlying personality traits and mental issues may lead to more serious conditions, such as, listen, this is very important, depression, substance abuse, and self-suicide. What is self-suicide? Well, it simply means death resulting from or during selfie taking. I think in one of my videos I'm going to do a short thing on self-suicide, and you'll see the economic impact and you'll see the number of deaths associated with selfie taking. What are the complications of self-hate? 1. Broken relationship. Of course, you have a boyfriend or a girlfriend that may not be comfortable with the way you post on social media, and that may result in a broken relationship. 2. There's a tendency for other addiction. Because it's an addiction, selfie addiction, it put you at risk for other addiction. It's also put oneself at risk of cyberbullying and trolling. Another complication is going extra length to secure validation of others, e.g., developing eating disorder. You have to look slim and beautiful. You want to conform. You want your shape to be figure eight. You want to look very beautiful. So you start going extra length. Other complications include depression with the risk of selficide and selfie death. Yes, there are a lot of recorded selfie deaths. I'm going to talk on this in my next video when I talk about selficide. So, how do we manage or how do we prevent? How do we treat this condition? Let's note, currently there is no scientific approved treatment for selfie obsession. In some severe cases, psychological counseling and cognitive behavioral therapy may be required, especially in the chronic level. Below are some of the things that we can do, you can do, or you can do for your friends to mitigate, to prevent, or to manage this condition. You may need to reduce, or the person may need to reduce the use of smartphone throughout the day. If you're always moving with your smartphone, you can reduce it. Either by dropping them in the house and having another phone that's not a smartphone that you cannot smooth with. By doing this, you're definitely going to help yourself either from preventing yourself from this disorder or from treating yourself from this disorder. 2, you decide when and how to use smartphone to your benefit. Is it always you need a smartphone? Should I use it in social scenario? By using it here, will it predispose me to uncheck picture taking and uploading? By doing this, it will help you. Number 3, you decide to reduce the frequent logging to social media. Well, here, when do I always use my social media? Is my data always on? Is there need to use data here? Should I log in? If you can limit this, of course, you can counter the effect of the tendency to upload pictures unchecked on social media. The next one is by practicing relaxation technique and stress management. Well, there's a way you do how to relax. As I told you, some of persons are predisposed to this problem because it helps them to relax. So if you know other ways of relaxation technique, it will help you. The next point is to seek your parents or well-wishers' cooperation to help you. How do you do this? If you recognize yourself that you are suffering from this disorder, you could talk to a trusted one and the person can help you. If you can abide by these simple tips, you will achieve your goal and you will win yourself from selfie habit. In severe cases where the above measures did not yield results, it is advisable to seek the help of a medical specialist. Please, it is advisable to seek the help of a medical specialist if the above measures fails. Why? Because of the complication of this disorder. In conclusion, although it may sound dramatic to refer to selfie obsession as a mental health disorder, several scientific studies have strengthened the validation of the claim. Thanks for listening. Please don't forget to like, comment, and share this video because this information will definitely help someone. Thank you and have a beautiful day. If you have any question, don't hesitate to drop your question in the comment section below and you'll be assured that your question will be answered almost immediately. Thank you.